3, 2.
Fellow Dominicans living at home and abroad, residents, visitors, friends, ladies and gentlemen. This day has been feared but prepared for ever since the emergence of coronavirus in mid-December of last year. Local health officials have been monitoring developments associated with the acceleration in spread and impact of this global pandemic. We knew first that this day would come. The Minister for Health reported earlier today that Dominica had recorded its first positive testing for the virus. In the case of Dominica, it is a 54-year-old Dominican citizen who recently returned from the United Kingdom. As there were no known previous cases on Dominica, it must be assumed that he would have contracted the virus abroad. Therefore, if we were to rely on the global scientific formula of calculation and measurement, this would now place Dominica on level 2, as there is now a known presence of the virus on island. The individual is currently in isolation and is being monitored by health officials. I am told his physical health is fine, and health authorities are hopeful for a speedy recovery. What this level 2 means is that while there is the presence of the virus on island, it is not yet known to have spread. The experience of other countries suggests that the virus's impact in and on Dominica will intensify. But for now, we can only hope for the best while preparing for the worst. What does such preparation entail? It involves the resident population of Dominica working with health officials and national authorities to minimize the impact and spread of this virus. We do this first and foremost by being responsible. We need to practice good hygiene. It also means that we must guard against the spread of the virus on Dominica. Health officials have commenced a rigorous program of contact tracing, where they will be seeking to locate and interview all persons who would have come into contact with the patient. This does not mean that there has been spread, but the possibility and probability exist. Because of our respect for client confidentiality, it is not our intention to reveal the identity of the individual, but in a small society, one would wish that persons who believe they know the individual and may have come into contact with him would immediately contact the health authorities for guidance on what should be the next course of action. Ladies and gentlemen, the coronavirus, or COVID-19, as it is called, does not have to be a deadly disease in Dominica. Indeed, while we hear quite a lot about the fatality rate, little is said of the recovery rate, which I'm advised is still in the global vicinity of 98%. It means, therefore, that we need not fear being tested, and we need not shy away from self-quarantine, if indeed we're exposed to the spread of the virus in one way or another. Fellow Dominicans, it is imperative that we work together as one people to contain the spread of this virus and to minimize the number of Dominicans that will be affected. We already know that the majority of persons who will contract this virus, more than 80%, will only have mild symptoms. The greater risk is for our senior citizens and for those of our citizens who have a chronic underlying condition like diabetes, hypertension, cardiovascular disease, or asthma. These are the persons who must take particular care, and who must now alter their behavior to ensure that they remain out of harm's way as far as possible. What does this mean? Simply put, I am asking all persons over the age of 70 years old, or any person who has a chronic underlying condition that is not being managed properly to stay at home and minimize contact with the general public. I'm asking them and others to follow all of the warnings that the doctors have shared with us. For example, 1, wash your hands regularly or use hand sanitizer, and do not place your hands on your face. 2, if you must sneeze or cough, sneeze into a tissue and immediately dispose the tissue in a covered bin and wash your hands. Cough into your elbow to avoid harming anyone. My government is adopting a 4-stage approach to the management of the virus of this pandemic. With the revelation of the first imported case, we have moved from level 1 to level 2. Against that background, I am making a decision to suspend all classes of school from tomorrow. We shall intensify screening at our borders, and I anticipate that in a day or two, we shall be announcing new measures and regulations with respect to opening of our ports of entry. Suffice to say, Dominica shall follow international practice and guidelines in this regard. We are a small nation, and with the positive testing, it will take a few days for persons abroad wanting to return home and for visitors wanting to return to their homes to formalize such travel. Also, I anticipate that we will need to stock up on vital supplies, especially medical and health-related cargo. As of tomorrow, we shall beef up security and screening at our ports of entry, and by midweek, I shall have more to say on the issue of mandatory quarantine of persons entering our island. I urge citizens to take the opportunity for the next few days to stock up on essential items. There is no need for panic, and there is no need for hoarding of goods. Act in a manner as to reflect an appreciation for the fact that this situation is now urgent and that Dominica will have to act swiftly to protect itself from further importation of this disease. We anticipate that more rigorous screening, testing, and contact tracing could and very well lead to unearthing of additional cases. We have a clear module that we shall follow, and in the days ahead, we shall be keeping in contact with you to ensure that the country is well informed. I am also putting Dominicans on alert that each one of us must take the extra precautions that are necessary if all of us are to be protected. With each stage, we shall announce additional restrictions and actions. It is imperative that you only follow official government statements, as this is a period in which a lot of fake news has flourished in other countries. Just as we have survived the horror of Erica, Irma, and Maria, just as we have survived earthquakes, we too, my brothers and sisters, we can and will survive this pandemic. It is not going to be an easy road. It has not been easy in any part of the world, from China to the United States of America, from Italy to Iran. We have a resilience that many have admired. It is that Dominican resilience that I call upon now to allow us to enter this new phase that threatens our people and the gains we have been able to make in rebuilding Dominica. Stay tuned to our official announcements and let us act together to protect each other. May the good Lord bless our country, and may the Lord bless each and every Dominican. Again, please follow the instructions from the Ministry of Health. This is not a time for us to panic, but for us to act in a decisive manner, but a responsible manner. And we're urging all citizens to take precaution. Thank you very much. Good night.